Imagine a 7-year-old boy named Leo and asks his mother, Mom, why does it taste sweet?
Mom, why does my runny nose taste sweet? It tastes like sugar water.
This sweet fluid isn't mucus. How does it travel through our brain, and why is it there in the first place?
So, let's gonna discover the ventricular system. Ventricles of the brain are a system of communicating cavities located deep within the brain, responsible for containing and draining cerebrospinal fluid. It consists of 2 lateral ventricles, the third ventricle, and the fourth ventricle. So now, let's talk about the lateral ventricles. This is the part of the telencephalon. Each lateral ventricle communicates with the third ventricle via the interventricular foramen, but they do not communicate with each other. The third ventricle. The third ventricle is the part of the diencephalon. The third ventricle is a narrow, slit-like cavity situated vertically along the midline of the diencephalon. Ventricle. This is the part of the rhombencephalon. The fourth ventricle is located in the midline of the pons and medulla oblongata anteriorly and the cerebellum posteriorly. And then, let's gonna discuss about the ventricular structure. The lateral ventricles are sheath-shaped structure. Each lateral ventricle consists of a central part and 3 horns. Anterior horn is located within the frontal lobe, posterior to the genu of the corpus callosum. Posterior horn, located within the occipital lobe and is often asymmetrical. Inferior horn curves downward and forward from the collateral trigone into the temporal lobe. Central part, this is the junctions where the 3 horns meet, situated at the posterior pole of the thalamus. The third ventricle is a narrow, slit-like cavity situated vertically along the midline of the diencephalon. It is roughly quadrilateral in shape with a roof and a floor. Roof formed by the tela choroidae and choral plexus. Lateral walls. Each one is divided by the hypothalamic circuits into 2 parts, the thalamus and the hypothalamus. Anterior wall, formed by the columns of the fornix, the anterior commissure, the lamina terminalis, and the optic chiasm. Posterior inferior wall includes the pineal gland, the posterior commissure, and the superior opening of the cerebral aqueducts. Floor corresponds to the infundibular recess and pituitary gland. The fourth ventricle consists of 2 walls and 4 angles. Anterior wall, also known as the floor of 4 ventricles of the rhomboid fossa. It contains 2 primary circuits, the median circus and the circuit limitans. Between these lies the medial eminence, which includes the following structures: facial colliculus, stria medullaris of the fourth ventricle, hypocostal triangle, vagal angle. Along the circus limitans, there are also the superior fovi and inferior fovi. Posterior wall is the superior medullary velum is continuous with the 2 superior cerebellar peduncle. Along the lateral margins of the inferior medullary velum are the tenii of the fourth ventricle, which meet at the apex. For angles is the superior angle communicates with the cerebral aqueduct. The inferior angles communicated with the central canal.
1. Origins and characteristics of cerebrospinal fluid. Primarily produced by the choroid pressure within the ventricle. A secondary source in the interstitial fluid derived from blood vessel subarachnoid space, which enter via the perivascular space, especially in case of ventricular absorption. A clear colorless liquid, it contains lower concentrations of proteins and glucose, but higher concentrations of chlorides minus and potassium plus compared to plasma. Volume 80 to 200 cc with a turnover rate of 4 to 5 times 24 hours. Compartments and circulation. The CSF it contains between 2 compartments that communicate via openings in the roof of the fourth ventricle. Internal compartment comprises the ventricular system. External compartment comprises the subarachnoid space and the subarachnoid system. Circulation pathway. Lateral ventricles, foramen of Mongo. Third ventricles, cerebral aqueduct of Sirius. Fourth ventricle, foramen of Lusca, or foramen of Maranello. Subarachnoid space of spinal cord. Absorption via arachnoid granulation into the neural venous sizes. Clinical examination of cerebrospinal fluid. CSF is an important tool for evaluating inflammation, sepsis, hemorrhage of subarachnoid space, and malignant. Proteins, glucose, platelets, and antibody have increased diagnostic specificity. Diagnosis indication: identifying infections and monitoring treatment response, confirming hemorrhage of subarachnoid space and malignant infiltration, measuring protein ratios in immunological disease case. Treatment: reducing intracranial pressure, ingesting medicine to subarachnoid space or spinal anesthesia, myelography to assess CSF flow and absorption. Contraindication: skin infection, appendicitis or sepsis. Coagulopathy, INR bigger 1.4, platelets smaller 50,000 per cubic millimeter, or platelet dysfunction. cervicospinal cord lesion, intracranial pressure increase or intracranial space occupying lesion.
Hydrocephalus 1. Definition. Hydrocephalus is the excessive accumulation of within brain ventricles resulting from an imbalance between its production, circulation, and absorption. 2. Causes. Communicating hydrocephalus. The accumulation of cerebrospinal fluid is impaired absorption at the arachnoid granulations, while there is no obstruction within the ventricular system. Non-communicating hydrocephalus. An obstruction of cerebrospinal fluid flows within the ventricles. The most common sign of obstruction is the cerebral aqueduct of Sylvius. Hydrocephalus because of brain atrophy, expanding of the cerebral ventricle secondary to brain parenchyma atrophy. 3. Symptoms. In infants, head circumference rapidly increased, pouching anterior fontanelle, telescopic ruminant veins, and dissecting sensile. In older children, morning headache and projectile vomiting, gait dystopathic, ataxia, and cognitive decline. 4. Common treatment modalities. Ventricular peritoneal shunt, VP shunt. This procedure involves the surgical implantation of cylindrical catheter system to create an artificial drainage pathway for cerebrospinal fluid, CSF. Endoscopic transventriculostomy, ETV. An endoscope is used to create a small opening in the floor of the third ventricle, allowing cerebrospinal fluid to bypass the site of obstruction. 5. Recent study published in the Vietnam Medical Journal, June 2025, ETV plus CPC. This study focused on the combination of endoscopic third ventriculostomy, ETV, and choroid plexus cauterization, CPC, in neonate, mean 11.1 days. This combined a break time to limit the excessive secretion of cerebrospinal fluid. Advantage. This dual action addresses both the inflow, reduction, and outflow, circulation, or drainage of CSF. It helps to reduce the lifelong dependence on systems in infants.